First, Kimiko Tobimatu is the author of Kimiko Does Cancer, a graphic memoir about her experience navigating breast cancer as a young, queer, mixed-race woman. By day, Kimiko was an employment and human rights lawyer in Toronto, as well as owner of Kimiko & Co., an online greeting card and stationery business. Kimiko Does Cancer is her first book. And for those who joined possibly a little later, the book is available in the library at Princess Margaret. You can also purchase it, of course, but you're welcome to borrow it from the library as well. Next, Keet Geniza is an illustrator and a cartoonist born and raised in Manila. Their art practice employs prose, poetry, comics, drawing, painting, and printmaking that is deeply influenced with the tension and interplay of personal heritage, persistent childhood anecdotes, and narrative reinvention. They have published over 50 zines, and their work has appeared in Just Femme and Dandy magazine, Broken Pencil magazine, and other publications. Kimiko Does Cancer is their first book and long-form comic work. They currently live and work in North Scarborough. So now I'll turn things over to Kimiko and Keet and ask you to share your presentation.
Hi, everybody.
Perfect. Okay. Yes. Hi. So yeah, I'm Kimiko, and Keet and I worked on a book together over about 3 years, and it was about my experience getting cancer when I was 25. So we're going to start off just with doing a bit of a reading from the comic, and then we'll jump into some questions. So happy to chat with you. And as we read, some folks may not have heard a comic read aloud before. So just Keet's got some sound effects we're going to use. Also, I'll be providing visual descriptions for any folks who might not be able to see the page. So hopefully you can still follow along. So we're going to jump around a little bit in the comic, and we're going to start with kind of when I'm first finding out my diagnosis. So Keet, are you able to see the screen?
Yeah.
Perfect. Okay. So yeah, this is in the first chapter, and we're starting off with we see Kimiko seated beside her mother, who's got tears in her eyes, and they're on a bench across from a doctor who's got a piece of paper in his hands. And in the bottom 3 panels, we see close-ups of Kimiko, each with a different expression on her face. The first is sort of nervous and worried. The third is really excited. And then the last is, again, kind of apprehensive. So to start, to get through the waiting as I was finding my diagnosis, I told myself not to worry until I had a reason to worry. But then the results came.
You had a rare form of breast cancer, mucinous, but it's good news. It's not aggressive with high survival rates, and we got it all out, so no more cancer.
Kimiko thought to herself, oh yes, I'm just the luckiest.
Now, to discuss treatment to prevent reoccurrence, we don't want any cancer cells hanging around elsewhere.
I didn't know how to feel. I had expected cancer, but it confused me to have it confirmed at the same time I learned the cancer was gone.
30 seconds into the news.
Thinking to myself, damn, it really was cancer.
60 seconds into the news.
Yay, I'm cancer-free.
90 seconds into the news.
But wait, what kind of treatment are we talking about? On this next page, we see 9 identical sized panels, each with a different doctor or medical professional. And in the first, it only has text, and each of the doctor panels see they're speaking and sharing different feedback about appropriate treatment for Kimiko. I had to make several important snap decisions about my treatment. I also had to wrestle with the fact that there was no consensus among my doctors about what caused the cancer or even how best to proceed.
Hi, Kimiko. Let's talk chemo. We advise sending your tumor to California to see if you need chemo. Provincial healthcare should cover the cost. Kimiko, chemo doesn't make sense for you. We'll stick to radiation. There's a risk of radiation splatter when radiation directed at one breast spills over to the other, increasing your chance of secondary cancer. Our machines are too advanced now for radiation splatter to occur. Given that your grandma and aunt had reproductive cancers, it may be genetic. The gene test came back clear. Only one variation, it may not be related. Good news is you don't have the BRCA gene. Note, people who have this gene are genetically predisposed to cancer. Some women consider a preventive mastectomy.
And then we're going to jump ahead a little bit into the decision-making around fertility treatment. And on this page, we see Kimiko seated beside her partner. Across from them is a doctor who is smiling, and there's a giant photo of a baby in the background. In the bottom two panels, one has a close-up of Kimiko and her partner, and the other has a close-up of the doctor with a picture of a kid behind her. Because of the potential impact of treatment on my fertility, my doctors encouraged me to consider family planning.
You need to decide today if you want to freeze your eggs. With a cancer discount, it'll still cost about $7,000 plus $400 a year for storage. More later if you decide to inseminate.
Today, I don't even know if I want kids.
Well, the first fertility pill is inexpensive and harmless. You can start on that to buy 2 more days to decide.
The next page is a full spread, and we see Kimiko seated between 2 couples in a waiting area. And there are 3 large pictures of babies behind them. Harvesting my eggs was an awful experience. I don't regret it, but I was in such a different place from the couples around me. They were all older and desperate to be parents. For me, cancer pushed the decision before I was ready.
We're going to have a family.
Kimiko's looking down, feeling nervous. In case you're wondering, they harvested 28 eggs. That's a lot of eggs on the rocks. I'm considering starting a side business if the whole lawyer thing doesn't pan out. We move on and see Kimiko seated between her 2 parents, again in a doctor's office. Her dad is taking notes, her mom is looking nervous, and the doctor's explaining different treatment options. On the next page is a close-up, or next panel is a close-up of Kimiko's mother asking a question, which the doctor responds to. And in the final panel, we see Kimiko looking to the side with a wondering expression. While the egg freezing for possible future baby making was happening, I was finalizing my treatment plan. The California test results suggested chemo wouldn't help me much.
Radiation will kill any lingering cancer cells. Then, to prevent recurrence, you'll need a quarterly shot and a daily pill to keep you menopausal because your cancer was so hormone sensitive. Her mother replies, "Should we consider a mastectomy instead of the drugs? The doctor responded, No, drugs are the best option. But if you do get a mastectomy, we'll get you sorted with plastic surgery to reconstruct your breasts so you don't have to deal with not having them."
Kimiko thinking to herself, losing my breasts wouldn't be the worst thing in the world. I wonder if I'd like the look. I could play with gender a bit more. On the next page, we see in the top 2 panels, Kimiko's in her family doctor's office and they're having a conversation. The doctor's taking notes. In the second panel, the doctor's walking out of the room and mentioning something as she leaves. And then in the final panel, we see Kimiko talking on the phone to a friend while on her laptop in her bedroom. As a queer woman, I went into this whole experience with some mistrust towards doctors, particularly around sexual and physical health. Kimiko asked her doctor, "How often should I get pap smears?"
The doctor replied, "Are you sexually active?"
Yes, with women.
Oh, well, that's okay then. Only women who sleep with men need PAPs.
Footnote, bad medical advice. My mistrust didn't go away when I got cancer. I asked a lot of questions, and I was lucky enough to have scientist friends to talk to as I did my own research. Talking on the phone. So what I've found so far, the next page in the first panel, we see a somewhat absent-minded expression on a doctor who's reading Kimiko's chart. There's then a close-up of Kimiko looking uncertain. And in the bottom panels, we see a different doctor lying in bed in the middle of the night. She then shoots up with a light bulb above her head and pulls out her iPad to write Kimiko an email. And we then see Kimiko receiving the email on her phone in her own bedroom and smiling as she reads the email. Asking questions proved important. My doctor sometimes made mistakes.
I'm filling in for Dr. Smith today. I understand that you had clear, wide margins around your tumor. 5 instead of 6 weeks of radiation should suffice.
My report said that the margins were narrow. But I also had some wonderful doctors.
Bing! Whoop! Bloop. From surgeon 3000 at hospital.com to Kimiko Tobimatu. Subject, a great idea. Dear Kimiko, I thought of a wonderful idea last night about how to address the discomfort you've been feeling in the scar, while not increasing the risk.
Okay, we're then going to move to the second chapter where we explore some of my experiences with the cancer community and moments of feeling a little bit isolated or disconnected from the mainstream narrative. So here we've got Kimiko at a cancer support center speaking with 3 feminine looking women who all appear to be going through cancer treatment, and Kimiko's introducing herself to them. And then down below we see different somewhat exaggerated poses and expressions of the 3 women that Kimiko meets. So they're taking kind of fighting poses, and then in another they've got really over the top wigs and flowers and glitter all around them. Towards the end of my 6-week radiation cycle, I wanted to meet others who'd had cancer, people who understood the experience and whose feelings I didn't have to manage. But sometimes it seemed that cancer was the only thing we had in common.
Welcome, Kimiko. I'm Macy.
Stacy.
Lacey.
We're survivors, fighters, warriors.
We kick cancer's butt.
And look good while doing it.
Now we eat. Oh.
On the next page, again, there's close-ups of Stacy, Macy, Lacey. In one, they're eating really healthy looking salads and foods. In another, they're mid-run for a cancer fundraiser. And in the final one, they're all holding hands as they skydive.
Now we eat right.
Support cancer fundraising. And live in the moment. In the final panel, Kimiko's creeping out of the room, and we just see Stacy looking out the door, trying to see where Kimiko went. Okay, so that didn't exactly happen, but that type of messaging was everywhere. The mainstream cancer narrative was so white, feminized, and apolitical. The peppiness seemed to gloss over the way cancer affected people differently based on race and class.
That's funny. Where did Kimiko get to?
Well, let's just say I won't be wearing a pink ribbon anytime soon. Okay, on the next page, Kimiko's talking to a researcher who's handing her an honorarium envelope. And in the bottom panels, we see Kimiko back at a cancer support center talking with a fellow patient. and he's looking very happy and relaxed, and Kimiko's looking nervous, a bit stunned. And in the bottom 3 panels, they're talking back and forth, and there's close-ups of each, again with Kimiko looking a little uncertain and him looking pretty happy. So first with the researcher. When you become a patient, particularly a young one, you get all sorts of requests to participate in research, both medical and sociological. While I was happy to contribute, it sometimes seemed like I was only being called on to fill a role. Kimiko speaking with the researcher. We need to include more people of varying gender identities and folks of color.
The person replies, yes, well, thank you for being our token diverse participant.
Post-cancer, I also felt like I was supposed to be enlightened in a way that didn't ring true for me.
Ever since I got diagnosed, it's like everything became clearer, you know? I understood life better. I stopped worrying about
Kimiko
everything.
thinks to herself, damn, my breath stinks. Sorry, I missed that. What were you saying?
Oh, just once that you had cancer, you stop sweating at small things, you know?
Yeah, sure. We see Kimiko then in a different cancer support group, seated in a room with 6 other people are present, and the facilitators opening up the floor. There are then close-ups of different participants contributing to the conversation, and Kimiko's looking nervous. I appreciated cancer support groups and sought the ones for queers or youth. But even so, it was sometimes hard to gel when differences like politics came up.
Who wants to start? I'm nervous about going back to work. Yeah, me too. I'm in the private sector. I'm not some lazy unionized worker.
Do I confront him on the union bashing? Kimiko thinks to herself. In a different cancer support group, we see Kimiko seated beside 3 people who are also patients, and 2 of them are looking really happy and positive, and the other one is looking uncertain. And we see each of them all having a conversation, and Kimiko isn't contributing, but looking increasingly uncomfortable. I found in cancer support groups, there was often too much emphasis on cheering each other up.
My doctors say that I'm inoperable. Don't get down. I was told that and now I'm in remission. Yeah, you gotta be positive. There's so much we still don't understand about cancer. Exactly. We gotta believe in our own recovery.
Kimiko thinking, this is painful to watch.
Well, in my case, the doctors do know. I have 3 to 5 months left to live.
Saw that coming. Leaving room to grieve can be as important as maintaining hope. There's then a page where the top half is a large image of a cancer fundraiser walk or run that's outside, and across from it we see Kimiko chatting with some justice for migrant workers activists, and there are signs say good enough to work, good enough to stay, and in the cancer fundraiser line there's kind of run for the cure, money saved me. Down below we see Kimiko talking with a person carrying a donation box for the run for the cure, and she's taking the box, and then she walks across the street and hands it to the migrant worker activists. Before cancer, I found it frustrating how much money went to generic cure for cancer efforts. There wasn't much talk of prevention or the roles gender and race play in diagnosis and treatment. The funding also seemed disproportionate to other equally important causes. Getting cancer didn't change my opinion. Which had me wistfully imagining, as Kimiko takes the box, I'm a survivor too. I can take this off your hands. And she brings it over to the activists. Okay, then we then have another large spread that shows a bounty of different goodies, like there's plants, there's cupcakes, flowers, cards, honorarium checks, gifts, and a large card that looks like a credit card. It says cancer card. It's sparkling, has Kimiko Tobimatu written on it. And down below, we see Kimiko at a hospital with a nurse passing along some free soda pop. And then Kimiko's at a cancer support center in front of a buffet, looking very happy at all the offerings. There were some perks to being in the Cancer Club. Yeah, sorry.
At the hospital. Pop anyone?
Sweet. I love free things.
At the cancer support place.
This place comes with free dinner. Gets better and better. We then on the next page see Kimiko holding a even flashier looking cancer card, and it has VIP written on the top. And she's handing the VIP cancer card over to her oncologist, wearing sunglasses and looking very spiffy. After that, we see Kimiko's surgeon speaking with her, and there's close-ups of each of them. And then Kimiko strutting through the hospital hallway with other patients surrounded and looking stunned. My relative youth meant a few additional cancer perks.
Swing!
You get special care.
Because you're so young, we're going to do every possible test to find the best treatment for you. We'll monitor you every 6 months on an ongoing basis.
Kimiko drops her sunglasses. Forever?
Well, I personally won't be around forever. Michael.
You also feel special in the cancer ward.
Did you see how young she is? He's got to be 18 years old.
I just realized, Keet, we were going to do another, but maybe it's 3:35. So I think it's probably best that we stop here.
Yeah.
So yeah, I hope you enjoyed and happy to chat.